In city like Bangalore, there are at least few thousand young men or young women in their 40s and 50s who are very fit, very athletic, with very advanced heart disease. If they run a marathon or if they run on a treadmill continuously, they can collapse. You see, in an ideal world, government should offer healthcare to all the citizens free of cost. Our government is hardly spending 1.5 2%, less than 2% of the GDP. So it's a wishful thinking that government should give free of cost, but that is not going to happen. The 4 to 6 hours after the heart attack is the golden period. In that period, if you land in the hospital, most of the heart attack can be reversed and your heart muscle can be saved. After 6 hours, you reach there, you can spend millions of dollars, your heart is damaged, and once the heart is damaged, it is permanent. No person has ever died due to hard work or stress if they didn't have a pre-existing disease. I wouldn't say nobody has died ever. I would say that it is very extremely rare for someone with a normal heart to die due to hard work. Is earlier we always blame the oil. Now the new villain is the carbohydrate, that is rice, chapati and sugar. We have to moderate these intake of these three things, especially sugar.
Hello and welcome to South First. I'm Chetna Belgare in conversation with world famous cardiac surgeon Dr. Devi Shetty, founder, chairman of Narayana Health. Doctor, it's a pleasure to be speaking to you. Thank you very much for being part of this conversation.
Thank you. Thank you.
Dr. Sunday, 29 September 2024 is observed as World Heart Day with an intention to increase public awareness of cardiovascular diseases. Post-COVID-19, we are hearing several cases of young people dying of heart attack, sudden deaths, due to heart attack. But do you think people are now aware of heart health, first of all?
I think people are aware, especially post-COVID, because COVID has woken up everyone about the importance of health and the awareness about the sudden cardiac arrest and sudden cardiac death always makes headlines at least once in a few weeks. And then the whole country starts buzzing with this young 40-year-old man who's athletic, CEO of one big company, collapsed on the treadmill. This keeps on happening. The reason why it looks as if the incidence of heart attack has increased, sudden cardiac death has increased, is because of the increased use of social media. You get to know more of these events happening in different parts of the world. Like you would have never met or heard about your classmates from school, but now every day you know what's happening in their life. So social media has brought all of us together. So that's one reason why we feel the incidence has increased tremendously. But I don't think it has increased to that level. Yeah.
Okay. So what does your OPD say, sir? I mean, because like you said, the reporting has definitely gone up and we have been noticing these incidents, and maybe we are hearing more of these incidents within our own families. We are seeing some cases like this, but like you said, this could be happening earlier as well. But what does your OPD actually say? Do you see that there is some kind of change in the nature of kind of people who are coming to the OPD, or what is it like?
We don't foresee that incidence has increased, but because of the incident increase in the awareness has increased now compared to what it used to be before. And more people are, the moment they get a chest pain or some discomfort, hyperacidity, they don't think it is a hyperacidity. They consult doctors, and more of the heart disease is diagnosed.
Okay.
But what is diagnosed is nothing compared to the undiagnosed heart patients.
Mm.
In city like Bangalore, there are at least few thousand young men or young women in their 40s and 50s who are very fit, very athletic, with very advanced heart disease. If they run a marathon or if they run on a treadmill continuously, they can collapse.
Yes.
So people attribute the sudden cardiac arrest happening to the stress. But believe me, any time when you read in the newspaper somebody had a sudden cardiac arrest and collapsed, If the same person had a cardiac evaluation 10 years earlier, and if they had a CT angio, which takes only 2 seconds, 10 years earlier, this death could have been predicted or prevented.
Okay. Okay.
So, in good old days, we didn't have the technology to detect heart disease at a young age, like a commonly performed stress test. You run on a treadmill and they record the ECG. That becomes positive when the blockage exceeds 70%. 70% blockage, knowing that is of no use. The reason is we should have known when it is 5%, 10%. Then we could have advised the patient to change the lifestyle, take medications. Then they could have postponed the onset of a cardiac problem. So it's very, very important that everyone should go for a preventive checkup at least once a year. And today, technology is there to diagnose almost all of the heart problems. And I can just give a message that no person has ever died due to hard work or stress if they didn't have a pre-existing disease. I wouldn't say nobody has died ever. I would say that it is very extremely rare for someone with a normal heart to die due to hard work.
Okay.
These people had a pre-existing disease, and then because of the stress or whatever the problem is, they had a cardiac arrest.
Okay. So you're saying there is no sudden heart attack as such.
Nothing is sudden. It is sudden for people who didn't know the status of their heart.
Okay, okay. So, so since today, I really thought we should get down to the basics of some of the questions. I'm sure you must have answered them 100 times, but we'll still ask you some of these questions. So, what are some signs of heart problems that people generally tend to ignore?
First of all, nearly 50% of the people who develop heart attack, heart disease, they have no idea that they have the heart disease. They have no symptoms, especially diabetics. This is called silent ischemia. So most of the patients who come to us to the hospital with a heart attack or a heart disease, they come because they went for a cataract surgery and the doctors wanted a cardiac opinion. Or they went for a gallbladder surgery, or they are traveling to US and the children would have said, get a checkup done before coming. Very few people actually see the doctor at the right time. That is the biggest problem we have. Because when you don't have pain, when you don't have symptoms, you think I'm a fit person. The message we are giving is how fit you feel has nothing to do with how fit you are. If you want me to say you're a fit person, I would like to see all your blood test report. I want to see your ECG, echocardiogram, CT angio of the heart, ultrasound of the tummy, and a doctor's report after examining you. So then I can say that, yes, you are a fit person. But generally, most people, if they have no symptom, they feel they are fit. And that is the biggest problem. Everyone past the age of 20 should know their numbers. They should know what their blood pressure is. They should know what their blood sugar is, cholesterol is. They should know what their kidney function is, heart function is, liver function is. Once you have this data, you know how all these organs are functioning. It was it was expensive and unreliable maybe 30, 40 years ago, these test reports, and most of the test reports were not there. Today, the technology has advanced technology is so much advanced, we can figure out what's happening with even the minutest cell of your body, but we are not using it.
At the time of the heart attack, like suppose somebody is going through a pain in the chest, like you said earlier, that there is now awareness and people probably think that this is not a gastric pain, but this is a chest pain and I need to go. So how do we differentiate between the two of it?
The problem is when a layman tries to differentiate between the cardiac pain and acidity pain. That's where the mistake is.
Okay.
You have pain anytime, which you have never experienced before. Go to the nearest cardiac hospital and get the test done. Let them do a ECG, let them do some blood tests. They will tell you. The biggest problem we have in treating heart patient is 2 o'clock at night, they get chest pain, they wake up. and they attribute the chest pain to the fish they ate for the dinner, and they sleep over. And next day morning, when the breathing difficulty gets worse, they go to the hospital. At that time, they have already missed the bus. The 4 to 6 hours after the heart attack is the golden period. In that period, if you land in the hospital, most of the heart attack can be reversed and your heart muscle can be saved. After 6 hours, you reach there, you can spend millions of dollars, your heart is damaged, and once the heart is damaged, it is permanent. It will never recover. You can do whatever you want, whatever treatment you take, a damaged muscle of the heart can never be revived. So, the biggest problem we have is lay people trying to differentiate between the cardiac pain and the acidity pain or a muscle pain. Don't ever do that. Consult the doctors, get the checkup done. In 1 hour, you can get all these tests done.
So one more question is, is there something called as mini heart attack? How long does it last and how do we identify that?
I am not very familiar with the term mini heart attack.
Yes.
There is something called anginal pain. Anginal pain is you have blockages, but it doesn't lead to the heart attack. But when you exert, you get chest discomfort. That is called anginal pain. And anginal pain has to be investigated at the earliest. Otherwise, that will lead to the heart attack. It's a God's way of giving you a signal that please go and get it sorted out. Yeah.
Okay.
It is an advance notice the heart is giving you.
Okay. So there were several posts recently on X, talking about how their loved ones or relatives died during the sleep, and then they said that it was heart attack in the sleep. So does that happen, and how is there any way to even know about it at all?
See, the heart attack can happen anytime. But the message I am trying to give you is that people who have a normal heart virtually can never die due to cardiac arrest. They all had a pre-existing disease. If they went for detailed evaluation of the heart, what I said, it shouldn't take more than an hour. They will know exactly what the status of the heart. If they have a normal heart with normal ECG, normal echo, normal CT angio, it is very, very, very unlikely that they will ever die due to sudden cardiac arrest.
Okay. So what is the role of diet in heart attacks, sir? Are there any foods that should be completely banned for people for their heart health?
See, the healthy diet for people with the heart disease or people with the normal heart who can develop blockages in the future is earlier we always blamed the oil. Now the new villain is the carbohydrate, that is rice, chapati, and sugar. We have to moderate these intake of these three things, especially sugar. So I recommend everyone to control the carbohydrate intake. Of course, they should control the oil as well. And avoiding the red meat will definitely help. If you already have a blockage, it will slow down the blockage. If you do not have a blockage, very unlikely you will develop a blockage, unless you have a genetic predisposition.
Okay. So is there any, with all these advent of wearable technology, do you think devices like smartwatches can actually effectively help in detection of heart issues?
The wearable, especially smartwatch, is an amazing tool, truly remarkable tool. Because first thing, my advice to everyone is to wear a smartwatch and count the number of steps. If you can walk 10,000 steps per day, believe me, it has a magical impact on your life. There are a lot of medical scientific articles published about the benefit of 10,000 steps. They have studied thousands of people who walked for a long period of time for 10,000 steps, and they had a huge impact on their quality of life in terms of cardiac health, liver health, overall body health, mental status, even cancer. I don't know how many steps you all walk, but most of you don't walk more than 3,000 steps. So wearing a smartwatch makes a huge difference. Then I recommend everyone use a AirPod, the earphone. And whenever you're walking, whenever you're talking, you wear a earphone and start walking. If you do that, you walk for extra half an hour to 1 hour every day without you being aware of it. So all these variables can make a huge difference in your lifestyle, in your health, by increasing your physical activities. So I'm a very strong advocate of smartwatches.
So,
And it can even diagnose electrical abnormality of the heart. It can diagnose many, many things. And in the years to come, it will diagnose blood sugar, your all kinds of things. It's a matter of time. Yeah.
so recently in an interview, we're talking about this pilot which you are working out in Bengaluru, where you're doing preventive checks. So how has that been going, sir? Any update on that? At an apartment, you said in an interview about workplace and apartments where you're actually doing preventive checks to monitor people's health, like a preventive heart health. So I just wanted to know what the status of that project is.
Yeah, you see, the biggest problem why fit people who don't get the preventive checkup is their aversion to go to a hospital, because hospital is not the happiest place. I have never come across anyone who says I'm happy to go to the hospital. So we thought if we can take preventive checkup close to the place of living or place of work, we believe that large number of people will go for a preventive checkup. So we are in the process of launching a pilot in Tech Park in Bangalore. Let's see how it goes, and then I'll come up with a good news that yes, if you take healthcare close to their house or a place of work, people will consume it. Let's see.
Okay, so I have one last question, that this is not directly connected to heart in terms of prevention or diagnosis as such, but this does concern hundreds and thousands of people who come to your healthcare thing. So the Aditi insurance scheme which you have started. So while it is something which is really appreciable, because a lot of people do come to Narayana, but there is also this critique which comes in about having a monopoly, and then how the US has actually failed in terms of this this kind of healthcare, where you're privatizing the insurance and then it gets really difficult, the wait time is long and things like that. So what do you have to talk about this particular healthcare scheme, sir?
You see, in an ideal world, government should offer healthcare to all the citizens free of cost. But we studied the governments which have been successfully implementing universal healthcare for free with the taxpayers' money. And all these countries are small countries with a very high tax to GDP ratio, and they're all spending between 10% to 18% of the GDP on healthcare. Our government is hardly spending 1.5, 2%, less than 2% of the GDP. So it's a wishful thinking that government should give free of cost, but that is not going to happen because we simply don't have that kind of a money. Forget about India, even United States of America, the richest country in the world, will not be able to offer healthcare to the citizens free of cost with the taxpayers' money. It's not possible. If US can't do it, obviously we can't do it. But the interesting thing is, Indians can't afford healthcare because it is very expensive. But Indians can afford a affordable health insurance. So this is the whole approach. If you can bring down the cost of insurance and make it affordable, then there is a hope. And we have tried everything possible. We try to reduce India is the lowest healthcare cost provider in the world. Nowhere in the world you will get the healthcare at the cost what you are getting in India. Still, more than 60-70% of the country's population cannot access healthcare. They simply don't have that money, right? And how long we can sit and hope for the government to get so much of money and offer healthcare? It's not possible. So we believe that hundreds and thousands of entities should come forward and launch the health insurance, collect money from millions of people. As more people get insured, the premium will go down and more people. So I have no problem. Anybody can come up with anything, but come up with something Don't sit on your chair and say that that is not good, this is not good. Do something. Then you'll be able to make a difference. We may fail, we may succeed, others may succeed, others may fail, but we shouldn't stop doing it. That is the whole idea.
Okay. So the scheme has been criticized also for focusing mainly on the surgical procedures, and it says that it's neglecting non-surgical treatment. So what do you have to say for this?
We are covering both surgical and non-surgical treatment. For surgical treatment, for 10,000 rupees, we are covering up to 1 crore rupees, because our dream is that the richest man of the country, whatever treatment he can afford, like a heart transplant or an artificial heart, which will cost 70, 80 lakh rupees, a poorest man should be in a position to afford. So we have covered them for surgical treatment. So we do not want people to choose the treatment option based on how much money they have. That is the greatest humiliation we doctors go through in giving the patient option. It is not like I have a shirt for 500 rupees or a 5,000 rupees. No, there is only one treatment for especially surgical treatment. There is only treatment. And a rich man or a poor man should be able to afford it. That is the whole idea. Now, for medical treatment, we cover up to 5 lakh rupees, because medical treatment opens a very, very complex area where we won't be able to control the cost, because there are various ways of treating. So we restricted to 5 lakh rupees. But this is the pilot we are doing to see how people will receive. Yeah. If you can't save life with 5 lakh rupees, it's not that easy to save with 10 lakh rupees. Yeah.
Sir, last question, and after that, I want your message on 5 things to maintain good heart health. But my last question is, with Narayana hospitals mainly primarily based in urban areas, what steps are being taken to extend the benefits of this Aditi scheme to rural families?
As I said, this is just a pilot. We are doing it to see, because this is the first time in India a hospital is becoming a health insurance company. So, as within a year or so, we will understand how the whole thing works. Once we learn, then we roll it out across the country. Yeah, that's the whole plan. But initially, we are doing the pilot right now.
Okay, okay. Sir, thank you very much for speaking to us. But your last message, if you could tell us 5 easy things to do to maintain a good heart health, and also tests which you think that we should be doing every once a year. You have told us few of it, but if you could concise and tell us.
Yeah, the test one should do at least once a year is a blood test with all the at least some 50, 100 parameters. Then a ECG, echocardiogram, and once in 5 years or 7 years, a CT angio, abdominal ultrasound, then mammogram, pap smear for the ladies, the bone densitometry for the elderly. These are the standard tests. All these tests can be done within 2 hours. The way my advice for leading a healthy life is get up early in the morning and go to sleep early. That's very important. Then everyone should exercise irrespective of the age. And the best exercise which can be easily done is a brisk walk. And I'm a very strong advocate of yoga, and yoga is the best gift India has given to the world. Then I would like you to understand that the villain is not oil, it is a carbohydrate. So rice, chapati, and sugar, you have to restrict as much as possible. Of course, you have to restrict the oil to some extent. No red meat, you can eat vegetarian, non-vegetarian food. Don't get into the extreme food habits, uh, which may not be easily sustainable, and it may not be very good. And my last message to everyone is be spiritual. It's very, very important for all of us to be spiritual. Believe in God, because we all lead a very stressful life. And the fact that if we trust that there is somebody up there who will take care of you is a very, very comforting experience. That's my message. Thank you so much.
Thank you, Dr. Devi Shetty. It was wonderful speaking to you. Thank you very much.
Thank you.